Hello, my name is Yan Zhang in Jeju National University College of Veterinary Medicine. The title of presentation is Decreasing of Basal Metabolism, mass blood glucose level by intermittent fasting. I experimented with Seung Lee and we experimented with intermittent fasting, which has been popular recently as a diet method. I have studied the effects of intermittent fasting on body composition, especially the changes in basic metabolism, body fat mass, and blood glucose level. Motive. Various diet methods have been introduced in recent years as modern people's interest in health has increased. Among them, intermittent fasting has become very popular, with television programs about intermittent fasting, and several celebrities praised it very highly. We were interested in losing weight and tried various ways to lose weight. We then realized that it is more difficult to maintain or reduce weight than to lose weight. To maintain weight for a long time and build a healthy body, it is essential to increase the basic metabolic rate. It is common sense that increasing muscle mass through strength exercise is the best way to raise the basic metabolic rate. However, for busy Bonka first-year students who didn't have enough time to exercise, the method was actually too much, so we began to study whether we could increase our basic metabolic rate with only intermittent fasting without exercise. As diabetes increases, it is becoming a disease of modern people. In fact, some people in the family have diabetes, so I became interested in blood glucose level. However, the method of unconditionally restricting food intake was difficult to live realistically. Therefore, this study will investigate whether limiting the time of food intake is effective in lowering blood glucose level and study the sustainable dietary control method for diabetic patients. So through this study, we want to find out whether limiting food intake time is effective in lowering blood glucose level and whether intermittent fasting is a sustainable diet for diabetics. Background. What is intermittent fasting? It is intermittent alternation between periods of eating patterns by fasting and non-fasting. There are two methods of intermittent fasting, whole day fasting and time-restricted fasting. Whole day fasting is called 5-2 diets. It includes 5 days per week, not fasting, and 2 days per week, either total fasting or modified fasting. Brenda Pillon, the author of Eat Stop Eat, suggested that 24-hour fasting is the most effective way. According to his research, 70% of the reduction in insulin levels occurs in the first 24 hours of fasting. Over 50% of the increase in plasma-free fatty acids occurs in the first 18 to 24 hours of fasting. Time-restricted feeding (TRF) involves eating only during a certain number of hours each day. The most well-known TRF method is the 16 to 8 method, in which the fasting period is 16 out of 24 hours and eating is restricted to a period of 8 hours. This is the blood glucose level chart we used when we looked at changes in our blood glucose level. Object. The aim of this study is to investigate the effect of intermittent fasting on body weight, body composition, and blood glucose level in overweight or obese students. We examine which of intermittent fasting and strength exercise has a greater effect on weight loss and health. We examine if the intermittent fasting is an effective method for type 2 diabetes patients. Positive effect of intermittent fasting. According to recent research, it induces repeat ketosis, causes self-purification of cell by autophagy, and increases insulin sensitivity. First, it induces rapid ketosis. So what is ketone? When glucose is depleted, the fatty acid burns and is used for energy. As a result of this, ketone body is produced in our body. The positive metabolic changes that occur in IF are metabolic switch from mainly carbohydrate metabolism to mainly fat metabolism. Mobilization of free fatty acids from the adipose tissue increases. These fatty acids are partly used to form ketone bodies through ketogenesis. The ketone bodies can in turn be used directly by certain organs and can also be used by the brain as an alternative energy instead of glucose. After a period of adaptation, this graph shows that ketone level increases and glucose level decreases after fasting. Second, it causes self-purification of cell by autophagy. Autophagy is the body's mechanism of getting rid of all the broken down old cell machinery. What stimulates autophagy? It is fasting. Fasting raises glucagon and increases in glucagon stimulates autophagy. Also, fasting stimulates growth hormone. After clearing out all our junky proteins and cellular parts, our bodies get a complete renovation. Clearing these old abnormal proteins prevents the development of Alzheimer's disease and cancer. This graph shows that production of stem cell of IF group is more active than that of control group. It means autophagy becomes more active. Third, it increases insulin sensitivity. Studies have shown intermittent fasting for patients with type 2 diabetes to have a positive effect on insulin resistance. Cells become insulin resistant when they are forcibly stuffed with glucose and fatty acids, but periods of fasting allow for this extra glucose and fat to be burned off in due time. As a result, the cells become responsive to insulin. This is the blood glucose level chart we used when we looked at changes in our blood glucose level. Object. The aim of this study is to investigate the effect of intermittent fasting on body weight, body composition, and blood glucose level in overweight or obese students. We examine which of intermittent fasting and strength exercise has a greater effect on weight loss and health. We examine if the intermittent fasting is an effective method for type 2 diabetes patients. Sample size. We used the G-Power program to obtain the sample size. The effect size F was set at 0.25. The alpha error probe was set at 0.05, the power at 0.8, the group at 3, and the measurement at 5. As a result, the sample size was 125. Therefore, we set up 42 people for each group. Materials. For the experiment on blood glucose meter in body 570 and a specimen were needed. Methods. The experiment was divided into three groups. First, it's a control group that doesn't exercise and intermittently fasts. Secondly, it's a exercise group that exercises and intermittently fasts. Lastly, it's a IF group that intermittently fasts. The procedure was similar to the 16-to-8 method among intermittent fasting methods. This was revised to 15-to-9 because of the parallel with the study. The 15-to-9 method is to fast for 15 hours and eat only for 9 hours. We decided not to eat from 9 p.m. to 12 p.m. and the exercise group exercised at the gym for 1 hour 5 times a week. BMI and blood glucose level were measured 5 times on fasting every Monday for 4 weeks from April 29 to May 27. This table is the average age, height, and weight of each group. The results are as follows. These three tables are the results of the representative sample. Some samples have little change, but this representative sample is the most obvious result of the sample. The first table is the result of one of the control groups. The second table is the result of one of the exercise groups. The last table is the result of IF groups. The results of the IF group showed that basal metabolism, body fat mass, and blood glucose level were clearly reduced. And this graph is a graph of the average of each group value. You can clearly see the reduction in the graph. Finally, it is a table showing the average value of reduction rate. Basal metabolism increased only in the exercise group and decreased in the other groups. The decrease in basal metabolism was also greater in IF group than control group. Decrease of fat mass, blood glucose level were apparent in IF group and exercise group. Discussion. The purpose of this study was to investigate the effects of intermittent fasting on changes in basal metabolic rate, body fat mass, and blood glucose level. For this purpose, 42 female students were divided into three groups: control group, exercise group, IF group. The 15 to 9 methods was selected and measured every Monday, and a total of 5 measurements were made. As a result, the increase of basal metabolic rate was observed only in the exercise group, and the IF group showed the greatest decrease. The reason for the decrease in basal metabolism in the IF group is because of the decrease in muscle mass. Body fat mass and blood glucose level were clearly reduced in exercise group and IF group. Conclusion. Intermittent fasting reduces both Beijing metabolism, body fat mass, and blood glucose level. This result unexpectedly decreased the basal metabolic rate of the IF group, but it was effective in reducing body fat mass and blood glucose level. Therefore, intermittent fasting is suitable for use by a healthy person for the purpose of maintaining health. It can also be effective on short-term diets. However, long-time dieting can be counterproductive if the exercise is not performed because of the decrease in basal metabolism. The 4-week experiment was short to conclude, but this is the conclusion I have gained through this experiment. Through this, we found that doing intermittent fasting is good for health. I also found that short-term dieting has some effect, but in the long run, the basal metabolic rate decreased, which can be counterproductive. To do a long-term diet, exercise should be done in parallel. These are references. Thank you for listening to the announcement.